As a brain doctor, I have to start with something that may surprise you, and honestly, it may even scare you. One of the most common shower habits seniors have, something you may even do tonight before bed, could silently raise your risk of stroke overnight. I am not talking about skipping a shower or forgetting your soap. I am talking about the temperature, timing, and way you shower at night. And let me be clear, I am not here to frighten you without reason. I have seen too many seniors in my hospital who never realized their evening shower routine was quietly putting their brain in danger. That is why I want you to stay with me until the very end of this video. Because by the end, you will know not only the dangerous mistake to avoid, but also the safer way to shower that protects your brain, your heart, and your life. Now let me ask you right at the start, do you take your showers in the morning or at night? And when you do shower at night, do you like it hot, warm, or maybe even cold? Leave me your answer in the comments right now, because I want to know how many of you are already unknowingly walking into this risk. Let me begin with a story. A man named Robert, age 72, came to me one night after collapsing in his bedroom. He had been perfectly fine before bed. He enjoyed his dinner, watched his favorite TV show, then went for his usual hot shower. He told me he liked his showers steaming, so hot that the mirrors fogged up and the tiles dripped with condensation. He thought it helped him relax and fall asleep faster, but just hours later he woke up dizzy, his speech slurred, and he fell trying to stand. By the time his wife got him to the hospital, Robert had suffered a mini stroke. When I looked deeper, I realized his nightly hot shower habit was one of the hidden triggers. Robert never knew his relaxing shower could be dangerous. And sadly, he is not alone. Here is why. When you step into a hot shower, your blood vessels widen. This is called vasodilation. For younger people with flexible circulation, it may not be a big deal. But for seniors, especially those with high blood pressure, diabetes, or heart disease, the sudden expansion can cause blood pressure to drop quickly. Now combine that with the fact that at night your body is already lowering blood pressure naturally to prepare for sleep. The extra shock from hot water can cause blood to flow unevenly, straining the brain. The result is dizziness, fainting, or in severe cases, stroke. Now I want to pause here. Have you ever stepped out of a shower and felt lightheaded, maybe even needed to sit down? If that has happened to you, please tell me in the comments. It may have felt harmless, but it is your body warning you that the habit is too stressful for your circulation. Another hidden danger is showering right after eating. Seniors often like to clean up after dinner and before bed. But after a meal, your body directs blood to your stomach to help digestion. If you then take a hot shower, your skin pulls blood outward, away from the brain. The stomach demands blood, the skin demands blood, and the brain ends up shortchanged. For someone over 60, that lack of oxygen supply can trigger sudden dizziness, blurred vision, or worse, a stroke during the night. I once treated a woman named Patricia, age 69, who fainted in her bathroom for exactly this reason. She had eaten a heavy pasta dinner, then went straight to the shower. The combination of digestion and hot water pulled blood away from her brain. She collapsed and hit her shoulder badly. She was lucky she did not suffer a stroke, but it was a close call. This is why I always tell my patients, never take a shower immediately after dinner. Give yourself at least 90 minutes, ideally 2 hours before you shower. Let your body finish the heavy work of digestion first. Now, let us talk about something most seniors do not realize: the bathroom environment itself. Seniors often keep bathrooms closed, with little ventilation. Hot water steams up the room, creating a humid, oxygen-poor environment. For someone with weaker circulation, this can cause the brain to get less oxygen. Combine heat, low oxygen, and low blood pressure, and your risk for fainting or stroke skyrockets. If you are listening to this right now, I want you to think back. Have you ever felt strangely short of breath in a steamy shower? Did you ever feel your heart race or your head pound afterward? If yes, let me know in the comments because your experience may help other seniors realize the hidden danger they are ignoring. Now, I do not want you to think that showering itself is the enemy. Bathing is important for hygiene, confidence, and comfort. The danger lies in how and when you shower. Let us talk about safer strategies. Number 1. Water temperature. If you must shower at night, keep the water lukewarm, not hot. Lukewarm water relaxes muscles without shocking your blood vessels. Number 2. Timing. Shower at least 1 hour before bed, not immediately before lying down. This gives your body time to stabilize blood pressure and circulation. Number 3. Avoid late-night showers past midnight. At that hour, your brain is most vulnerable to circulation dips. Number 4. If you enjoy hot water, take your shower in the morning. Your circulation is stronger, blood pressure is higher, and your body is better able to handle the stress. Let me share another story. A woman named Linda, 68 years old, loved her nightly ritual of hot showers. She said it reminded her of younger days when she had more energy and less pain. But one night, she fainted just as she stepped out of the shower. The sudden temperature difference between the hot bathroom and her cooler bedroom shocked her blood vessels, and her blood pressure dropped dramatically. She collapsed, hitting her head on the dresser. Thankfully, her daughter found her quickly. Linda survived, but she never forgot that night. Today, she still showers, but only in the morning with safer temperatures. I tell you these stories not to scare you, but because I want you to avoid becoming the next Robert or Patricia or Linda. These were real people who never thought a shower could harm them. But once you understand how your body changes with age, you see how even small routines can carry hidden risks. Here is one more scientific fact to keep in mind. Our body follows something called a circadian rhythm. This is your internal clock. At night, your heart slows down, your blood vessels relax, and your blood pressure naturally dips. That is normal and healthy. But when you add the stress of a hot shower, you disrupt this rhythm. Instead of a calm, steady flow, your circulation jumps up and down. Your brain, which depends on a stable supply of blood and oxygen, gets confused. This is why strokes and heart attacks are most common in the early morning hours after a disturbed night. So, what can you do if you love the comfort of bathing at night? One trick I often recommend to my senior patients is a warm foot soak. Fill a small tub with warm, not hot, water and soak your feet for 10 minutes before bed. This relaxes your body, calms your nervous system, and prepares you for sleep without straining circulation. Seniors in many cultures use this method, and it is far safer than a full hot shower. In the next part, I am going to reveal the most dangerous mistake seniors make in the shower that almost no one talks about. It is not just about hot water. It is something even more surprising. I will also share additional safety tips and more real patient stories, so you can protect your brain for years to come. In Part 1, I told you how hot nighttime showers and poor timing can quietly raise your stroke risk overnight. We spoke about seniors like Robert, Patricia, and Linda, who never imagined their nightly rituals could turn dangerous. Now, in this second part, I want to take you even deeper, because there is another shower habit that is even more dangerous, yet very few people talk about it. And if you or someone you love does this, you may be walking into one of the highest stroke risks without knowing. The danger I am talking about is sudden temperature shock. Many seniors think alternating between hot and cold water is healthy. You may have heard that cold showers build strength, improve circulation, or even wake up the body. That may be true for younger people, but for someone over 60, with weaker blood vessels and slower circulation, that shock can be devastating. Imagine stepping from hot water into cold, or suddenly blasting your body with icy water at night. Your blood vessels, which had just widened, now constrict rapidly. The brain suddenly faces a surge in pressure, then a drop. These violent swings can trigger arrhythmias, spikes in blood pressure, or even blood clots breaking loose. For a senior with hardened arteries, this is a recipe for stroke. Let me tell you about a man named Henry, 74 years old. Henry believed cold showers were the secret to staying strong. He had read articles online and wanted to prove he was still tough, still capable. So every night, he would end his shower with 30 seconds of ice-cold water. He said it made him feel alive. But one night, after blasting his chest with cold water, he collapsed. His wife found him unresponsive on the bathroom floor. When he came to my hospital, the scans showed he had suffered a stroke. His arteries were already narrowed from age, and the shock of cold water caused a surge in blood pressure that his brain simply could not handle. Henry survived, but he now struggles with weakness in his right hand and slurred speech. His story is a heartbreaking reminder that what may be good advice for a 25-year-old athlete can be deadly for a 70-year-old retiree. So please, if you are over 60, avoid cold shocks in the shower, especially at night. Stick to warm or lukewarm water. Your brain will thank you. Now, I want you to pause and think. Have you ever stepped into cold water and felt your chest tighten, your heart pound, or your breath stop for a moment? If so, that was your body telling you it was under stress. Share your experience in the comments because other seniors need to know they are not alone. Another shower danger seniors often overlook is staying in too long. You may enjoy the comfort, letting the water run over you, singing, thinking, even dozing off under the warmth. But long showers, especially hot ones, dehydrate your body. They strip natural oils from your skin, but more importantly, they lower blood volume. When your blood volume drops, your blood thickens. Thick blood is more likely to form clots, and clots are the #1 direct cause of stroke. I had a patient named Margaret, 70 years old, who loved long baths and showers. She would sometimes sit under the water for 30 minutes, enjoying the steam. One morning, she came in with a clot in her leg that had traveled upward. Luckily, it was caught before it reached her brain. Margaret was stunned. She told me she never connected her relaxing showers with her health scare. After that day, she shortened her showers to 10 minutes, drank water afterward, and never had another clot problem. Here is a rule I want you to write down. Seniors should keep showers under 15 minutes, drink a glass of water afterward, and avoid extremes in temperature. These 3 steps alone can lower stroke risk more than most people realize. Now let us talk about the environment outside the shower. Many seniors shower at night and then step immediately into a cold bedroom. That rapid temperature drop is dangerous. It shocks your blood vessels, just like switching from hot to cold water. Your heart races, your pressure drops, and your brain is caught in the middle. If you must shower at night, dry yourself completely, put on warm clothing, and avoid stepping into a cold, drafty room. I remember a man named Samuel, 76 years old, who suffered his stroke this exact way. He took a hot shower, stepped into his air-conditioned bedroom, and collapsed within minutes. His wife thought it was the flu, but when we scanned his brain, it was clear. A stroke had struck. The combination of heat, cold, and circulation shifts had overwhelmed his aging arteries. Now, I want to get personal with you for a moment. Many of you watching this are seniors who value independence. You want to care for yourself, live with dignity, and not rely on others. I understand that deeply. I have spoken to countless patients who say, "Mark, I do not want to be a burden." That is why I am telling you this. Something as simple as adjusting your shower habit could mean the difference between living independently and being dependent after a stroke. It may sound dramatic, but I have seen it happen too many times to stay silent. So please, for yourself and for the people who love you, take these shower warnings seriously. Now, let me give you a few extra tips for safe bathing. Tip 1. Install a shower chair. If you ever feel lightheaded, you can sit safely. Tip 2. Keep your bathroom well ventilated to avoid excess steam and low oxygen. Tip 3. Place a non-slip mat outside and inside the shower. Falls combined with fainting are a double danger. Tip 4. Shower in the early evening instead of late at night. This avoids both digestion conflict and overnight blood pressure dips. Tip 5. Always tell your doctor if you experience dizziness, fainting, or headaches after a shower. These are red flags that your circulation is not coping. And here is something many seniors do not know. Even the time of year matters. In winter, the contrast between hot bathrooms and cold bedrooms is greater, making stroke risk higher. In summer, dehydration from long hot showers makes blood thicker, also raising stroke risk. Every season carries its own hidden danger. Adjust your habits accordingly. Before I end, I want to share one final story. A woman named Grace, 71, loved her nightly hot showers. It was her way of ending the day. Will you risk your brain health for a moment of hot comfort, or will you choose the safer path that lets you stay independent, strong, and present for your family? The decision is yours. If you are still with me, tell me in the comments, what will you change in your shower routine after hearing this? Will you shorten your showers, lower the temperature, or move them earlier in the day? Your comment could inspire someone else to make a life-saving choice tonight. Remember, stroke prevention is not only about medications or checkups. It is about daily habits. The way you eat, the way you move, the way you sleep, and yes, the way you shower, all add up to either protect or harm your brain. I care about you. That is why I share these truths, even when they are uncomfortable, because I want you to live long, live healthy, and stay free from the pain that stroke brings. I have seen too many families broken by what could have been prevented. I do not want that for you. So be wise, be safe, and take action tonight. Adjust your shower routine. Share this video with your loved ones so they can protect themselves too. And never forget, you have the power to shape your health with simple choices every day.